Our group is doing dialectical behavioral therapy, or DBT for short. Dialectical behavioral therapy was originally developed by Marcia M. Linehan, and it came out as kind of a third wave therapy in the last 10 to 15 years through cognitive behavioral therapy. And cognitive behavioral therapy, or some call it CBT, or is different than DBT. DBT has that component of mindfulness and acceptance techniques. Another way of looking at it is CBT is protocol based, so there's an outline of everything a therapist has to do with the clients, and DBT is a lot more principle based. So there's principles that we'll talk about a little bit later that a clinician or a therapist goes off of, and it makes it a lot more flexible and very important for people that are highly emotional. DBT also takes the judgment out of CBT. So that means that it teaches clients that there's no wrong or distorted way of thinking. But the goal is also to still change their way of thinking. So DBT acknowledges that there's a problem with the way clients think, but therapists also encourage clients to accept this and not judge it. And then they help them look for ways they can change their thinking to be more balanced. So it's really about being more flexible and helping clients accept their emotions and not think of it as a wrong way of thinking. So this treatment is also meant for people who are highly suicidal, self-injurious, and highly emotional people, or that's how it was developed. And then Marshall Linehan also found in her research that it's really good for people with borderline personality disorder, because those are the people that are mostly at risk for these behaviors. And her philosophy was that if we wanted to keep people alive, as we do when we hospitalize people for their suicidal urges, then we need to figure out how else to keep them alive and help them create lives that are worth living for. And so DBT, again, it has that emphasis on behavioral therapy as well as with the mindfulness techniques. Part of that understanding how to live a life that's worth living for is understanding that pain is a part of life, and you can have pain and you can also have a life worth living for. And that's kind of what dialectics are in DBT. So it's the balancing of what things seem to be like opposites, but when used together can be useful and practical. So in DBT, they focus on acceptance and change as two things that are seemingly opposite but are used together. Acceptance, the willingness to experience ourselves and life as it is, and change, knowing that change is going to happen, but we can't change something unless we first accept it. So this helps teach clients that there is going to be fighting reality causes more suffering, and suffering is what you want to avoid. You want to tolerate the pain that can come from that, but accept it in a non-judgmental way so you don't fall into a suffering pattern. So the main goal is also to strengthen a person's ability to handle stress without losing control or becoming destructive. This approach can be used for a variety of mental illnesses, but it's most commonly used for people with borderline personality disorder because they often tend to go towards more distressful, overwhelming crisis modes because they do not know how to accept that pain is different than suffering. So why use dialectical behavioral therapy? So Linehan made it specifically for people with borderline personality disorder at first because this is the population, like I said before, has the highest risk for suicide. Statistics show that 70 to 75% of people with borderline personality disorder have had at least one self-injurious act, and those with that history have had at least double the risk of making a suicidal attempt. But it can be used for an array of different mental illnesses. So if you want to think about how it can be used, one good way is to maybe close your eyes and picture a time when you felt very overwhelmed emotionally. Some people say it kind of feels like a tsunami of emotions. You tend not to think about them because you don't want to get covered by the waves. So you're distressing. So you're pushing those emotions away, and by doing that, you're making the waves bigger. So the more you try to cover up those emotions because of how big the waves are, the more likely you are going to get more overwhelmed and start to feel like you're drowning. This creates what's called emotional dysregulation. So that's a huge key indicator that DBT would be really useful. So if there's a client that you can see has a lot of inability to regulate their own emotions, then they're suffering from their emotions, and DBT is a very good approach for that. Where emotional dysregulation comes from. Having the inability to control emotions is somewhat hardwired from birth, but trauma is also a lead indicator that can make someone struggle. Research has shown that people with borderline personality disorder and other diagnoses have difficulty with mood regulation and have developed this also from mirroring the invalidating environment. So that comes from social cognitive learning, which is also a part of DBT theoretical basis, because people learn how to handle their emotions from observing others. So that's like kids watching their parents have really stressful ways of coping with their emotions and acting out in anger and things like that. So over time, they've told themselves that their feelings are wrong and have criticized themselves for having these when others do not, so that when they're triggered, they go into an emotional crisis. Then they might engage in behaviors to escape the pain, such as substance use, self-harm, suicide, or quitting a job or a relationship. Once they get the relief from that escape, the shame from those behaviors, start the process all over again, and they continue into that emotional crisis. So DBT has these core principles that it acts on, and one of those principles, also an assumption, is that the therapeutic alliance is really important. So the therapist should be just as invested as the client. There must be a level of agreement on the tasks and goals between the client and the therapist, because studies have shown that the more positive the relationship between client and therapist, the more positive the results, which is kind of obvious, but it goes back to that theory about mirroring. So if a client can see the therapist being very validating and accepting, they will also start to behave this way and become more self-validating towards themselves. And it can also help develop more or better interpersonal skills, and people with borderline personality disorder have difficulty, especially with this interpersonal skill building. So another one of the principles is behavior change. So it's about helping people find a true balance in their emotions, thoughts, and behaviors, teaching them they can live in balance. So saying both of these behaviors are happening and what can we do to change them. Validation is acknowledging another's reality and seeing their thoughts as real and valid. And validation is huge in DBT. So it's saying, yes, everything you're saying is true and I validate that. And what else is also true? So why is validation important to the therapeutic relationship? And I kind of mentioned that before. It teaches clients to self-validate themselves. Part of that mirroring, it's changing those or learned patterns of behavior, and you're teaching them new patterns of behavior and ways to think about themselves and validate themselves. DBT focuses on 4 main skills to help reduce the size of these emotional waves, so people don't get or can control the way they're feeling so they don't get overwhelmed. The first tool is mindfulness, which is the process of feeling fully present in the moment and focusing less on the painful experiences from the past and the what-ifs that can come from the future. So tools such as how to overcome negative judgments about yourself and others, and how to concentrate on what's happening on yourself and what's happening in front of you. So people with borderline personality disorder can need a lot of help with mindfulness sometimes, because they tend to process things about what other people are doing wrong, how their pain and suffering is coming from the things outside of them. Mindfulness takes them back in. The stress tolerance is another one that is used to help people cope with these painful experiences by building up their resiliency. So tools to help people soften the effects of these painful experiences. So it's crisis survival skills, self-soothing with the 5 senses, radical acceptance, tuning into the mind, understanding wise mind, breathing exercises, and awareness techniques. There's also emotional regulation, which helps people recognize more clearly what they're feeling and how to observe their emotions without letting them control or overwhelm. So that's helps with increasing more positive emotions and decreasing emotional suffering by understanding your own emotions and developing a language to express them. And finally, interpersonal effectiveness, which is developing an effective communication toolkit to express your personal beliefs, needs, and your boundaries. It also gives people tools to negotiate their problems without ruining relationships by teaching them how to respect others and evaluate their own goals beyond what others see them as, so how they can talk about their goals in a way that's towards them and express themselves without making other people upset. More techniques used in DBT are these acronyms. So one of them is Dear Man, which is about getting your objectives and goals met in any given situation. And it's asking for what you want, how to say no, and negotiating conflict. It stands for describe, express, assert, reinforce, and then mindful, appear confident, and then negotiate. So that's how to get your goals met. Relationship effectiveness skills, they use the acronym GIVE, gentle, interested, validate, easy manner. So that's how to get what you need in a relationship without judging, without threatening, using listening skills, acknowledging their feelings. So people who struggle with emotional dysregulation are more likely to struggle with maintaining healthy relationships. And then you could use the GIVE acronym for that. And then finally, self-respect. Effectiveness can be used with the acronym FAST, which stands for fair, apologize, stick to values, and be truthful when working with others and to yourself.
So there are several diagnoses that DBT treats. Originally, though, it was developed specifically for borderline personality disorder. It also has been found to successfully treat people that are experiencing depression, bulimia, binge eating, bipolar disorder, post-traumatic stress disorder, and substance abuse. For the sake of the time limit, I'm going to go over just how it applies to a couple of these. And the skills taught with DBT have been found to be helpful with people that are wanting to improve their ability to regulate emotions, tolerate distress and negative emotion, be mindful and present in the given moment, and communicate and interact effectively with others. So first we're going to focus on how it treats borderline personality disorder. So what it does is it helps the person learn how to focus on being mindful and paying attention to their present moment. And it also teaches them skills to control intense emotions, reduce self-destructive behavior, manage distress, and improve relationships. It helps them work to seek a balance between accepting and changing behaviors. And like mentioned before, it was originally designed specifically to treat borderline personality disorder, and it's considered a provocative problem-solving approach. And studies have actually found that DBT is the most effective treatment for borderline personality disorder. So moving on, we're going to talk about how it treats depression. It has proven to be effective in treating depression symptoms, including difficulty concentrating, thinking, or remembering, persistent sadness or irritation, lack of interest in once pleasurable activities, recurring thoughts of suicide or death, headaches, chronic pain, and other physical problems that don't typically respond to treatment. So a large emphasis of DBT does surround validation and tolerance. And this is something that we often see people with depression struggling with. They often don't feel like they're validated and they're tolerated, and they're really negative on themselves. So DBT does a great job of teaching new coping mechanisms that allows the client to address the negative parts of their lives and then learn how to move on from them and grow and kind of have more positive thoughts. And the group treatment part focuses on helping learn how to resolve crises in a more functional and effective way. So DBT treatment for depression, another part that I found really interesting was a lot of articles talked about the use of diary cards in DBT and how that has proven to be very effective with helping people with depression. And a lot of that has to do with like just keeping track of their behaviors, so specifically their invalidating behaviors and thoughts that tend to affect them the most. And this also helps them keep track of their coping mechanisms so they can kind of know what works well, what doesn't, and then talk about that with their therapist later. So it just helps to kind of track that so it's easily remembered later on. And then PTSD can also be treated with DBT. So people with PTSD often struggle with difficulty managing emotions, interpersonal problems, and high risk of impulsive behavior. And DBT focuses on all of this. It really focuses on helping patients learn skills that will decrease emotion, dysregulation, self-destructive behaviors, and other unhealthy coping mechanisms. So it treats PTSD symptoms by addressing and removing dangerous behavior commonly seen among individuals with PTSD, developing a trusting relationship between the therapist and patients, which we all know how important that is. It's important that patients feel like they can trust their therapist to work with them. And then teaching skills that regulate emotions or symptoms of PTSD through mindfulness concepts, interpersonal effectiveness skills, and distress tolerance skills. And it teaches people how to control their behaviors and how to analyze their emotional and psychological issues. It encourages patients to identify their emotional experiences and manage them through the skills they learn and practice in therapy. And it helps them use real-life scenarios to teach mindfulness, interpersonal effectiveness, distress tolerance, and emotional regulation skills. So DBT skills training groups. Okay, so now moving on, we're moving on to the different settings that it's applied in. There's 4 different settings we're going to talk about. The first one is the skills training groups. Therapists teach behavioral skills that are designed to target behavioral skill deficits that are common to patients with borderline personality disorder, which includes an unstable sense of self, chaotic relationships, fear of abandonment, emotional liability, and impulsivity. And the 4 main areas that they focus on within these training groups are mindfulness, interpersonal effectiveness, emotion regulation, and distress tolerance, which is how they try to teach those skills that we just mentioned. These training groups are ran like a class, and there's often practice homework that's assigned. And the classes typically meet for 2.5 hours once a week over a 24-week period. And then the second component is individual therapy. So clients meet individually with their primary therapist to focus on the specific challenges that they are facing. There are 6 main areas of focus, and they include parasuicidal behaviors, therapy interfering behaviors, behaviors that interfere with quality of life, behavioral skills acquisition, post-traumatic stress behaviors, and self-respect behaviors. And these individual therapy sessions do coincide with the group therapy, and it's meant to enhance the group therapy. And then moving on, so the next one is phone coaching. That's the third component. And this is where individual therapists are available in between their sessions over the phone if needed. This is especially beneficial when when specific difficult situations arise and the client needs in-the-moment coaching. If it's something that can't wait until they have their next skills group or individual therapy, it's really helpful to be able to be contacting their therapist through the phone. And these calls are specifically designed to teach patients how to ask for help effectively and to apply skills learned in therapy to everyday life and to reduce parasuicidal behavior. An interesting thing I found, though, is that not all therapists choose to participate in this portion of DBT. Some kind of feel overwhelmed by the idea of their clients having 24/7 access to them. And then the last component is the DBT therapist consultation team. So this is where therapists meet with each other weekly and they can kind of motivate each other and compare their notes. This has been found to help prevent burnout for therapists and helps them process the trauma they see. This then helps them be able to be more attentive and effective with the care they provide. As we've seen before, like there's so much value in being able to work with other professionals who are kind of trained on the same thing as you, but might have a different perspective. So if a therapist is kind of stuck on a problem they're having with a client, it helps a lot to be able to consult with other professionals.
Okay, what does the research say about DBT? I chose a few articles that were, I thought, the highest value in research, meta-analysis, and systematic reviews. So the first one I found is assessing the efficacy of DBT, looking at adults with borderline personality disorder in 5 randomized controlled trials. Overall, DBT showed to be efficacious or effective in decreasing suicidal and self-harming acts. And even though there were trends to show DBT is working to improve, quote, life-interfering behaviors in general, the meta-analysis actually failed to show DBT as effective in behavior change. The researchers said this could be because of the difficulty in demonstrating behavior change. It could be the assumptions that people with personality disorder, the assumptions that those people lack certain skills and abilities, among some other things. So they think more research is needed around that. The authors also mentioned that the effectiveness could be in the fidelity of the therapist. One study showed a high success rate, which had therapists who had more experience of 22 years on average. And so, yeah, more research needs to be done on looking at the fidelity of therapists in implementing DBT. They had some qualitative, they looked at qualitative research as well, and I really love qualitative research, so I just highlighted what I thought was interesting. It showed the participants in those studies showed that it improved suicidality. They showed positive change growth for depression, anxiety, global functioning, and social adjustment. So DBT showed success in clients learning skills to reduce symptoms and regulate their emotions, which is a little bit different than the qualitative findings they found in that study. The next article I found was looking at DBT skills training as a standalone treatment. This was a systematic review of the treatment outcome literature. So 17 trials using DBT skills training only were identified, and those excluded other components of DBT. These results showed preliminary evidence of using skills training as a standalone for treating symptoms of mental health and behavioral problems. Interestingly, they found that the evidence of skills training as a standalone treatment to be effective in reducing behavior symptoms, but not really in suicidality, which is common among BPD. And that is different than the other article that I found, although this one is focused on skills training and not the full implementation, so that could be a reason why. There was also preliminary evidence of showing to be able to use DBT skills training across different populations. The different articles in these 17 ones they identified were showing DBT to be used with binge eating behaviors, major depressive disorder, ADHD related substance use and impulsivity, the coping and self-care behaviors of caregivers of adults with dementia. That one's kind of different and interesting. Intellectual disabilities, borderline personality disorder, and also incarcerated individuals. They believe higher rigorous methods need to be applied to look more into this research. And then the next one I thought was actually a little bit different, interesting one. This article is a recent article from this year, 2018, and they looked at benchmarks. The article is called Benchmarks for Outpatient Dialectical Behavior Therapy in Adults with Borderline Personality Disorder. And due to how services are provided to clients between research-based and community settings, you may not be able to assume that implementing the complete DBT protocol to clients will be as effective as possible. So the difference between looking at what the research says and what's actually happening in a community-based setting looks a lot different. And so this looked at how they could find benchmarks to use DBT in settings versus finding like what are the outcomes you want to see. You're not always going to see that because you're trying to fit the intervention to to your client's needs, and so that can sometimes change the way you implement therapy. And also there's lack of time for a lot of practitioners to time to actually implement it fully or access to measuring it properly. So the benchmarks that they found, they looked at 3 behaviors of self-harm, depression, and anger. And you can see on the slides, I just put down the questionnaires that they wanted to use to kind of gauge the benchmarks if you're a practitioner who's implementing DBT. And for self-harm, it's suicidal behaviors questionnaire 14. For depression, they use the Beck Depression Inventory or Hamilton Depression Rating Scale. And for anger, they used Spielberger's State Trait Anger Expression Inventory. They did not look at the behaviors of impulsivity, dissociation, and aggression in this study. So thus, when practitioners need to adapt DBT to fit their client's needs, they can use these benchmarks to see the client's progression in these skilled areas over time. The next one I looked at was systematic and meta-analysis of DBT in adolescents. And I did this. I know a lot of people are interested in working with adolescents. So this research study looked at pharmacological, social, and psychological therapeutic interventions to see how they helped in reducing suicidal or self-harm in adolescents. And the top 3 that showed the highest effect sizes for reducing self-harm was DBT, CBT, and MBT. And this shows to be effective, and these 3 interventions should be researched more, they believe. The next study I found was also focused on adolescents, and it's preliminary evidence for the effectiveness of DBT for adolescents. And this is a 2018 study, and they did do a big search, literature review, and meta-analysis, and looking at reducing the symptoms. They focused on articles that looked at reducing symptoms of depression, anxiety, self-injury, and suicide risk in adolescents. The results showed small to medium results in decreasing all 4 of these symptoms compared to the control or alternative treatment group. So because it was small to medium, these can't be generalized, although there is a lot of promise from these findings for the effectiveness of DBT. They also did see in the research that skills-only groups could be effective in decreasing these symptoms also, which is easier to implement than the full DBT, which is why there was that other study done that I talked about earlier. The authors also highlighted in the discussion that creating a rigorous DBT study can be really challenging to implement the fidelity of DBT in actual practice. And also because DBT is in early stages of its development still. And then lastly, I just wanted to highlight 2 other quick articles, not go too into depth, but I did find a couple good articles, one around intellectual disabilities and adapting DBT to work with folks who have intellectual disabilities. And so the evidence did show that adapting people have been successful in adapting DBT for these individuals, but the research can't make full conclusions on its efficacy, which makes sense since that's what the other articles that I found was struggling to make strong cases for DBT's efficacy yet, because of a variety of reasons. And then the other one was around eating disorders, and the treatments look effective, also here, but again, it needs more research to affirm efficacy of modified DBT for eating disorders. So that's the research, and hope you learned something.